Runners should strength train, but not all strength training is created equal. Let's face it, if you are a strong person, that doesn't mean you're an efficient runner or a great runner. When you are strength training, it's important that we focus on running specific movement patterns so that it will carry over into our running versus just focusing on a very generalized strength plan. That can still help your running, but if you're trying to get the most bang for your buck, let's go through some movement patterns that you can start implementing into your strength routine. If we can start to improve the way we move with these movement patterns, then we're gonna start to improve the way we run. So the first movement pattern that you should try to master is knees over toes. Now you may have heard that when you squat, you shouldn't bring your knees over your toes because it increases the load through your kneecap, which can hurt your knee. While it does increase the load through your knee, it is not a bad thing. It's actually very, very functional. When we run, our knee goes over our toes. When we get off the toilet, our knee goes over our toes. When we go down the stairs, our knees go over our toes. And that is how we are able to load our quads a little bit more and just move in this functional movement pattern. We shouldn't feel like we need to restrict how much movement our knees can go through, especially if they're strong and stable. This is no problem at all. It's not damaging anything in your knees. So a couple different exercises we can do to improve knees over toes. The first one is a skater squat while you're tapping a water bottle or a foam roller. So I'm gonna stand on one leg as I squat down. I'm loading my glute, I'm loading my quad, and I'm tapping the foam roller. You can see my knee is going over my toes, and then I'm coming back up. The other reason that this is really important is because when our knee translates over our ankle, over our toes, we are going into closed chain dorsiflexion, which is exactly what we do when we are running. So you're not just working on quad stability, knee stability, the functionality of knees over toes, you're also working on the ankle mobility. So it's like a triple whammy all in one. So again, coming down, loading glutes, loading quad, and tapping your foam roller or your water bottle. A big mistake I see runners make with this one is that we forget to load our glutes. So it kind of looks like this. You're just poking your knee forward. And while this isn't bad, because it's not bad that knees go over toes, you do want to load your glutes and load your quad equally so you have hip stability and knee stability. So you're not just doing this, okay? You load your glutes, load your quads, tap, and come back up. The second movement pattern is a hip hinge. You can think of this as a single leg deadlift or double leg deadlift, where your first movement is that your hips hinge back to load your glutes, load your hamstrings, stabilize your low back, and then you come back up. Now this is really important because it teaches your body to load the posterior chain and to work on that hip dominant movement pattern. There's a couple things we want to look at first before we just jump into deadlifting heavy weight, because quality over quantity any day of the week is so important. So as you hinge back, like I said, knees slightly bent, and your first movement is that your hips go back. Versus a squat, you're tending to drop down first. This one, you want to pretend like there's a wall behind you, and you want your glutes to tap the wall. As you do this, you'll start to feel your hamstrings being loaded, you'll start to feel your glutes being loaded, and then when it comes to your low back, you just want to keep your pelvis in a neutral position. You don't want to overarch your back or underarch your back or do any crazy curvatures of your low back. It is to stabilize. The low back is stabilizing. It's not accepting a load as a powerhouse muscle. So spine's in a neutral position, pelvis is in a neutral position, hinge back, maintain that neutral position. As your trunk comes down, you're loading more of your posterior chain. And this is where you can really start to tilt your pelvis forward to make sure it's still in that neutral position. That's going to allow you to really work on your core and use your core with this exercise. And then you come back up with control. If you're looking at this and you're like, I don't think I'm deadlifting correctly, try this exercise. This one is really good. I use this a lot with my rehab clients. Whether it's runner's knee, ITB syndrome, even Achilles tendonitis, you're going to grab a stick. You can grab like a golf club, a broomstick. I have a stick from Stick Mobility. It just has to be durable in order to work. You're gonna place it behind your body like this. So your head's in contact with the stick, and I have one arm overhead. It doesn't matter which arm is overhead. I have my stick touching my mid-back, then I have my stick touching my glutes, or like my low back sacral region, like this. And I wanna make sure that I'm not overarching my low back like this. I wanna make sure my pelvis stays in a neutral position. I cannot emphasize that enough in order for you to use your core correctly. So first start by getting the positioning correct. Now all you're gonna do is go into a hip hinge, like a good morning. You're gonna hinge back, maintain a neutral pelvis, and maintain those 3 contact areas. So your head, your mid-back, and your sacral region. Come down, don't lose it, and come back up. If you tend to lose the stick contacting like your sacral region or your glutes, it's probably gonna look like this, where you're just hinging your trunk forward, you're just bending it forward, you're not keeping those hips in line with your mid-back. A lot of control here. This is not a fast movement, and then come back up. Now this is something that you can practice even before a run, before your next workout. So then when you go into your workout and you are lifting weights, you are thinking about the stick's contact points as you come down into a deadlift, and you're not just going through the motions, because we don't like to do that here. We want it to actually carry over into our running. The third movement pattern you should try to master is single leg control. Now this does not mean just doing single leg squats over and over and over again, because in my experience as a PT and run coach, a lot of runners are not doing their single leg squats correctly. So if we're just emphasizing poor movement patterns, poor control, and we're just doing a ton of reps of those, it's not helping our running. It's actually probably making our running a little bit worse or increasing our risk for injury, which we don't want. So when it comes to single leg control, that really means focusing on unilateral exercises of the lower extremity, so just focusing on one side. And again, it's that quality of movement over quantity, so you're focusing on that control. If your single leg squat is wonky, it looks like this, your knees caving in, your pelvis is dropping down, then we need to regress or modify this movement so we can build up those areas that are a little bit weaker. So then when we go to practice the single leg squat, let's say a couple weeks down the road, a couple months down the road, we have that better movement pattern so it can display into our running. So for example, if that single leg squat is difficult, we can bring it down into a non-weight bearing position like a single leg bridge. When you're doing a single leg bridge, I want you to have your hands on your pelvis and one leg up. As you lift your pelvis up and down, you're focusing on using your glutes to lift your pelvis up. And then you're also, so you're holding up, and you're also making sure with your hands on your pelvis, you're not dropping one side of your pelvis down. You're keeping them level as you lift up and down. Now with that single leg bridge, you should not be feeling it in your low back. It's a glute max exercise and glute med exercise for that hip stability, that pelvic stability, and you want to be using your glute max to thrust your pelvis up. You don't want to be compensating by arching your low back like this. Like this is not doing much. It's actually teaching me a really bad movement pattern to use my low back to lift my pelvis up versus my glute max and my hamstring. From there, you can start to progress that single leg control, that single leg stability. So again, it displays into running because that is the overall goal. If we're gonna strength train as a runner, which we already probably don't wanna do, we wanna make sure it's actually improving our running. We're not just going through the motions of strength training. If you want to improve these movement patterns so you can run stronger and prevent your chance for injury, I recommend you go through the Runner's Complete program. It works on a couple more different movement patterns we haven't talked about today, but it really emphasizes the role of stability, mobility, strength using those powerhouse muscles, and then power applied metrics so you can run faster. I will link it below, and if you have any questions, just comment below as well.